Hello, everyone. Today is July the 22nd, Wednesday. I hate like crazy that we're going to lead off with telling you that we've lost a 67-year-old female from Cabell County. It's the 101st death in West Virginia. Again, I just go back to the same thing over and over and over. Please don't let this wonderful, wonderful lady become a statistic. Don't let that happen, West Virginia, because these people have names. These people have families and loved ones, and please keep them in your thoughts and prayers because they're not just a statistic. And so, we've got some good things to report about our numbers, and I'll get into those now, but yesterday our daily rate was down to 1.06%. That's terrific and everything. The number of cases, active cases in Mon County has dropped from 394 to 339. That's also very good. We surely don't have a run on our hospitals at this point in time. We have 77 people that are hospitalized in the state, and we had an additional 132 new positives reported this week, and I think that number's in error, but we'll go back and check that, but we did have 30 new positive cases that were reported yesterday. So that number could very well be right, but nevertheless, our numbers are moving for the last couple of days or 3 days back in the direction that we want them to move. Now, can we attribute all that to the fact that we did a mandatory executive order to make us all wear masks? Well, we probably can't. But we can say that something is making this move and move in our favor. And absolutely wearing the mask is absolutely making it move. Now, we're going to watch the numbers. And, I always am a believer that one robin doesn't make spring. And this is more like one robin right now as far as the reporting that we have. And so we'll go and we'll watch these numbers for a few more days. And then we'll be able to react as to how much and what the benefits have been by making it mandatory that we wear masks and we continue to do good stuff as West Virginians have done. Again, I can never thank you enough for being the miracle. West Virginia, you have really done it. And so with all this, we've still got to be very, very, very careful that we watch what's going on in Kentucky and South Carolina and Florida and Alabama now and Mississippi now and Texas and Arizona, all through the South. So we want to watch it and everything, and we want to absolutely wear a mask. I was delighted to see yesterday, our president come out, and he's always been this, but he was super supportive yesterday in telling all Americans to wear their mask. And so with all that being said, our numbers are a little bit better, and the only other thing, there's this R naught value. Now our R naught value that we want under 1% is 1.09%. I think, and Dr. Marsh can better talk about this than I, but I think that jumped up to in excess of 1.3. Now, and we were the number one state in the nation, as far as the highest R naught value, which means how many people can be inflicted with this disease or infected with this disease, how we're doing that one-to-one on a one-to-one basis. And so with all that being said, we were first in the nation, which is the worst that you can possibly be in some value, in this type of value. But then we went to third. Actually, I believe we went to second, and then we went to third, and then we went to sixth, and now we're 19th. So we're moving the way we want to move in regard to lots and lots of numbers. We're continuing to watch them. You'll hear from our medical panel in just a little bit. Okay, I have told you over and over and over that we had, and I don't know how to explain this any way other than this. We shepherded us through last year. We dealt with a pandemic that was a shot right directly to the stomach that was to the magnitude of 200 million plus. Right behind all of that, we dealt with a situation that we moved the income tax filing date till July 15th. When all that was going on, we were about $10 or $15 million in the hole. How in the world we got us across the finish line with basically a surplus? Again, I've said it many, many times. It is singly the biggest accomplishment since I've been here. But I give a lot of credit to a lot of people from our Department of Revenue to all of our, econ experts and everything, and we got there. Now I tell you that as we have CARES money to distribute, $1.25 billion, I've given you my plan and how we're going to go about that. I have said repeatedly, over and over and over, have I not, that we're building this mountain over on the other side of grant money that is available to us. Just like I said the other day, when there was some level of criticism, it was a political deal that came my way in regard to education. I said there's $94 million in the grant money already sitting there, that education people are going to be able to distribute. And Superintendent Birch and all of them, great job, and they're going to do a great job with that as well. Now, one of the other people that have really been hurting along the way here are volunteer fire departments, and we've been trying to figure out, well, what can we do? What can we do? You hate to say it, but in Kanawha County, the Salango headquarters, they're giving out monies, but those dollars are monies that basically they applied with us and we sent to them. Remember when I sent $100,000 to every county in the state, and they may run out and say that they're doing this or that. But let me tell you what we've done. We have found in one of the grants a way that we can send money directly to our volunteer fire departments. So today, I'm announced there's 419, and they suffered from the lack of being able to fundraise and doing all the different things they do. And we all know the beauty of what they give to all of us. I mean, can you just imagine how they run to the fire and they do it on a volunteer basis and everything, and all the good that they bring to each and every one of us. And our communities abound with volunteer fire departments. So today, through one of our grants, we're going to be able to send $10,000 to each and every one of the 419 volunteer fire departments. So, again, these are heroes, and they're heroes beyond belief. And so we're going to send $10,000 out to each and every one of our volunteer fire departments, and that's going to be just slightly in excess, or just slightly under, rather, $4.2 million. So tickled to death to do it. I thank them every day for all they do, and we'll just keep on doing goodness as much as we possibly can. The other thing I want to tell you is this: as of yesterday, in the grant monies, we had $1,103,794. So absolutely, I keep telling all of our legislature, I tell anybody and everybody, call us, look at any way and every way that you can qualify within the structure of those grants. And if we can get you qualified and everything, those dollars are available for you. And so please take advantage of that, West Virginia. Now, I'm going to go through other things really quickly and everything, but We had a call yesterday with all the higher ed community. There's 27, West Virginia public and private colleges and universities on the call with their presidents and everything. Great call. At the end of the day, all of our schools want the kids back, and the kids want to be back in school and want to be back on campus. The number one thing that is going on across the board is, how do we protect our kids? How do we protect our staff and faculty? How do we protect our communities where those kids will be? How do we really move forward with this in a way that is the very best of the best, and without disrupting this education process for these kids that is so important? And as well as the economics of what's going on with our colleges, we don't want to start losing our colleges or our universities within the state. So, how do we do that? And I will promise you this, I commend beyond belief the incredible plans that these people have put forward. And we've listened to all of them. We have listened to each and every one of them, and their plans are spectacular to ensure, without doubt, the safety of our kids and to ensure the staff and all those community and everyone around, is protected to the very, very best that we can possibly be. Now, what do we got to do? Here's what we got to do. We got to wait just as long as we possibly can. And I want those kids back in school. And I know that the kids want to be back in school. And I know that everybody wants them to be back in school. But I, at the top of this food chain, will tell you specifically just this. There's no way Jim Justice is going to go with putting these kids back in school unless I am completely convinced, to the very best of my abilities. Now, we all know we've got to manage some level of risk until we get a vaccine and we're able to stop this thing. We all know that. We are managing some level of risk here. But I absolutely promise you that there will be many, many more discussions and everything, but we will be making decisions very quickly because the decision time is upon us. And so we're going to continue to bide time and watch and hope and pray our numbers continue to be better and better and better, and then we can move forward. But, okay, let me see. We now have active outbreaks reported in churches in 8 counties. That's Mason, Boone, Grant, Logan, Kanawha, Raleigh, Taylor, and Wood counties. We have a total of 85 cases combined. I again strongly encourage everybody to social distance, wash your hands, absolutely a pew in between, wear your mask in church. It is the absolute potential breeding ground for this terrible killer, and we don't want to end up in front of a casket at a funeral home or at a funeral. Absolutely, we don't want to end up there, and we know that our elderly are absolutely a lot of those that are at church, and so we absolutely have got to be really super careful there. On our small business grants, the application process is up there, and we're moving forward very quickly about that. One of our past senators, Jeff Mullins, called me today with some questions in regard to that. And we're getting to the bottom of Jeff's questions and everything because he's getting feedback from small businesses as ways that we can expedite things and move things along to better be able to help them. And that's what we're trying to do. But we're going to get those monies out. Those monies are coming out to the smallest businesses from 1 to 35 people. And so those will be coming out very, very quickly. I want to remind you again about the free testing. The more we test, the more we know, the better we are. The more knowledge we have, the better we are. There'll be free testing this week in Brooke and Logan County, and next week in Gilmer and Marion counties. Go get tested. Please get tested. We've now sent out, as far as our grants and everything, to our cities and counties. We now have awarded nearly $52 million that have gone to 155 cities and counties. We continue to ask and continue to work to have more and more awards that we're able to comply with the guidelines and get out to you. And we ask that you'll just continue to apply. And we've still got plenty of money to be able to send out and everything. And we want to just keep doing it. The summer feeding program is now up to 696 sites. You know, there's well over 10,000 people that have used this map so far. And we want to continue to just make sure that no West Virginians go hungry. If you're having trouble, call 211. Please do that. I want to remind you again about the census. I don't want to sound like, we're beating a dead horse here, but please, please, please get counted. It's really, really, really important. Now, I want to report to you on something I just got from a standpoint of our state parks. We went on a campaign or a little bit of a crusade that we were going to do any and everything we could to upgrade our parks. I'm a believer with all my soul, that no frog that's not proud of his own pond is much of a frog. And so when it really boils right down to it, we got to be proud of who we are in West Virginia in every way. Every way. We're proud in lots of ways, but we need to project that pride to be able to convince people that this is the place for them to come. This is the place to bring their business. This is the place for them to come and live. Absolutely. And the other thing is, oftentimes we in West Virginia take off and spend our dollars all across the globe when really and truly there is no better place. There is no better place than West Virginia. So, but now just listen to these numbers. Today I have some really great news about our West Virginia state parks. In June of 2020, compared to June of 2019, we saw an increase from June to June. We saw an increase of 227% of our online reservations to West Virginia residents. The revenue from West Virginia residents increased by 187%, even though we were giving our West Virginia residents a 30% discount. It's amazing. It's good stuff. West Virginians are taking advantage of our state parks because they are a great place to socially distance while exploring the beauty of almost heaven, West Virginia. Under my administration, I made it a priority, like I said, to work on making our parks better. And through our state park bond program, projects are underway or planned in every single park. These projects are making our parks shine, and I am so proud to see West Virginians taking advantage of them. They're, like I've said over and over, they're your parks, your state parks. Go to them, enjoy them. You'll find something really special that's going on right there. And so, again, I commend Chelsea Ruby, all the great people at tourism and everything. Absolutely, all the wonderful people within our DNR and all the great work that Steve McDaniel and all of his troops have done and work every day at. It is an amazing story with a lot of good stuff. And if I forget someone, please forgive me. There's lots of people out there that are making a lot of great licks and everything, and I'm really, really, really proud of you. I think, I do want to show you the numbers real quick. If we could put the chart up, Jordan, if you could do that. Okay, look really close at our top line. Do you see the top line? The top line is growing or heading a little toward the north. And our bottom line, which is our active cases, just started to turn a little bit to the south. That's just what we've been looking for. And we want to continue to see that. Like I said, one robin doesn't make spring. We still got a long ways to go here. and everything. In the second line, you'll see our daily positive numbers. Our daily positive numbers continue to just drop, drop, drop. That's good, good, good. And then if you'll go over and look at our total percent of positive, you'll see that today we're at 2.15. That's not as good as it was, but it's surely heading back the way we want it to head. Long and short of this is just this. We've got lots and lots of goodness going on within this state. We're absolutely handling the money the way we ought to be handling the money. And congratulations to the fire departments and everything. We've been trying to find a way. We found a way. And the other thing I would just remind everybody, keep that beautiful lady from Cabell County in your thoughts and prayers. I'm sure she'll really be missed. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I also want to join the governor in thanking our citizens for your commitment to be rigorous and service-oriented with wearing masks and in situations where we're inside with each other. It is making a difference. The governor pointed out that we have seen a much better day today. Our R-T value, which is a derivative of the R-naught value, has migrated in the absolute better direction. And we are now the 19th from the worst in the country. We were 1, 2, 3, 4, 5, 6 over the last 7 or 8 days. And this is the time frame after the types of mitigation strategies like the mask order that we would anticipate that we would start to see some benefit. And while we can't be certain that we're going to have each day go exactly the way that we would hope, we do know that what you're doing individually and as communities together is making a big difference. And we are so proud of that activity. When it comes to masks, I wanted to go over a short video that was produced from West Virginia University in collaboration with NIOSH. So Jordan, if you could load up the video here. This is a test using a inhalational toxicology lab that basically uses blue dye and shows what happens with the spread of a forceful exhalation, a cough. And you can see here that when you have that cough that's generated, these blue dye dots go everywhere and include infecting potentially, if those are droplets with COVID, to go on another person. And if you cover your mouth, then you can still see those droplets get generated and dispersed in that environment. And by the way, this is a National Guard production as well, I believe. If you cough into your elbow, it does capture some of these droplets, and you can see that that starts to be more localized to your elbow and less that gets across to the other person. But I think that it is really important that wearing a mask is a real benefit here. And here you can see that with a mask on the coughing person, that blue dye is really captured in the mask. And this is the kind of mask that you can buy on Amazon or buy in other places, not a surgical mask. The other person is protected. And if you have a homemade mask, let's say a t-shirt mask, and you do the same thing, you can see that, again, the blue droplets, the dye is contained within that mask. And when you look at the other person is protected. What's really important is that, we've talked about how important it is to protect others from you, but a mask can also protect you a bit. Notice around the eyes that are not protected there, you see the dye, but around the part that the mask was protecting, you get no dye. Now, here's the important one. If you just do distancing alone, and you're basically not protected by a mask on either side, you can see that despite the distance, some of the blue dye droplets reach the other person. So this really demonstrates to me why it's so important to wear a mask, even if you are physically distancing. And these two things work really well together. So West Virginia, we couldn't be more proud of how you've done and responded to this pandemic for the whole duration. We are a state that are leading in this wave, in this pandemic, and we're so appreciative and so thankful from a health perspective that you are continuing to demonstrate the service and the altruism and the community that it really takes to see us be leaders in this country through this pandemic. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, a number of testing lanes are established for this coming week, so please take advantage of the opportunity to get tested and help us reduce and mitigate the spread. Sanitization missions, significant number of missions going on to support cleaning and mitigating spread. Just want to point out related to that, that is part of the initiative that the governor established with us for innovation. And not only are we helping to mitigate the spread, but the cost savings to the state of West Virginia, our counties related to using the National Guard and the equipment that we purchased is significant to our state going forward, particularly as we continue to address this over the next several months. In addition, our subject matter expert teams are working with our colleges and universities, as well as our county school boards in reviewing plans, as well as putting together equipment and activities to reduce and mitigate spread as we move back out in those areas. Yesterday, worked significantly with West Virginia University, working today with Kanawha County Schools and other county school systems. In addition, we have meetings going on to continue to develop partnerships related to PPE production, as well as securing additional PPE going forward. And as the governor pointed out, the National Guard, along with the Bureau of Public Health and the great work of the West Virginia Hospital Association, is closely monitoring our hospitals, our ICU beds, and our ventilator use as we go through these spikes. And again, on behalf of the National Guard, all the men and women and their families, we thank West Virginians for stepping up under the mask order and helping to reduce and mitigate the spread. Thank you.
Thank you, General. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayan Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, we're every day we're getting closer to the November general election. I wanted to hear your thoughts on, at this point, are you leaning towards allowing everyone in the state to request an absentee ballot like they did in the primary?
Charles, I want everybody to have an opportunity to vote, that's for sure. And from the standpoint of absentee, I think what we're going to do is go back to the way we were, but at the same time, if people are if we have a COVID situation that is really going to cause us a lot of troubles and everything, then I am a real advocate of the more people that vote and exercise their right to vote, and the more that we're able to have people have the opportunity to vote, the better. Now, from the absentee standpoint, we've got to know this. We've got to know that there is a ripe ability for people to fraudulently do things with absentee ballots. We know that. And I would much rather that we had the opportunity for everybody to come to the polls and everything. But we're reviewing that now. We've met with we've met with the AG's office. We've met with the Secretary of State's office. They're working on it and everything, and they're going to come out with the plans that we need to have.
All right, thank you, Charles. Next, we'll go to Zach Shrivers with WTAP.
Good afternoon, Governor. Zach Shrivers of WTAP News up in Parkersburg. I had a question about testing today. I've been talking to some people who have been tested, and a few people have told me they've gotten rather shallow tests using smaller Q-tips, and others have told me they've had very far extending tests up into their nose. In talking to some health professionals, they've been telling me that the longer ones are much more accurate. And so at this point in the game, I was wondering, why are we still using the less effective tests? And is there a risk in using those of getting more false negatives. Is that a concern for your administration?
Anything is always a concern, but Dr. Marsh, you've got to answer this, or Dr. Amjad, because you guys are a whole lot more versed on this than me.
Well, I'll start, Ein, if that's okay. There are several FDA-approved and CDC-approved ways that you can get a nasal sample, nasopharyngeal sample. Our initial one was the very deep swabs that you mentioned, but more and more today, we recognize that this is relatively uncomfortable for people more than an anterior nasal swab, which is the one that you said is a lot more shallow. And then there's a mid swab that goes up to the nasal turbinate. All of these swabs are felt to be equally as able to define virus. And we're really looking for people that have enough virus that all those would be positive. So Centers for Disease Control, Federal Drug Administration, all believe that these are equal. I don't know if you have more to add.
Sure, Zach. And there are different testing ones. LabCorp has one that looks like a Q-tip, and it basically it just gets the anterior part, and you'll see people swabbing it 3 times in each nostril. And then there's another one that does go deeper in your nose, and that's what most people watch videos, and it goes deeper in, and then that lasts for about a minute. But there are different kits out there that get different samples, but it basically does get enough of the sample that gets sent off for PCR testing. But they all work. They've all been FDA approved, but that's why you hear different stories out there. But they do look different. They test differently, but you get enough of the sample to get what we need.
All right, thank you, Zach. Next, we'll go to Sean Stinson with the Pendleton Times.
Hi, Governor. Sean Stinson with the Pendleton Times. I wanted to follow up on your comments at Monday's press briefing regarding the positive case here at Pendleton Manor in Franklin. You said you did not find out about the case until Sunday. However, it was announced by the administrator here on Wednesday that there was a positive case. I'm just curious as to why there was about a 4 or 5 day delay for you being informed of that case, as well as additional testing going on there for the rest of the residents and the staff.
Well, Sean, my answer to that would be really simple. I found out about it early on Sunday morning. From the standpoint of when it started and everything, I don't know how that equates into 5 days, but nevertheless, the bottom line is just this. As the reports are coming down, they're coming down from the health departments to all of our people, and our people are managing it and on top of everything. If I remember correctly, there was just one person, at the facility that tested positive. I think. Now I don't know that exactly and everything, but when the facility requested help, that's when I found out about it and I got involved, and that's when we came running. So I can't answer it any more truthfully than just that.
All right, thank you, Sean. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, after hearing from the universities and colleges yesterday with the plans that they're formulating and the testing, at what point did we get to diminishing returns on limited resources? Is it practical to want to test every college student in West Virginia? And how valuable is that, since that's just a one-day snapshot, instead of trying to find ways to make sure that they're COVID-free on a daily basis, which obviously you can't test every day? So what are we looking for here with level of risk management, as you said, versus there's no way to guarantee that you can't have a COVID outbreak somewhere?
Okay, Kenny, now listen to me, brother. You are the fellow that asked me the other day, you said, if we're only going to test the out-of-state people, does it not make more sense that we test everybody? From my standpoint, without any question, I think we should try as best we can to test everyone. And we're absolutely going to be able to push some extra dollars out to be able to do that and really help our smaller schools to be able to pull that off. Now, with that, as far as the snapshot, part of the question, it's just this. Sure, Kenny. I mean, you got this, and absolutely, I'm always impressed with your knowledge, and I mean that very sincerely. You are on top of this, and we all know that all we can possibly do is be able to manage our risk as best we can. That snapshot is only going to give us that snapshot. And then we may very well have to go back and do more and more and more. But if you'll look at what we did with our prisons, we ran to the fire. We tested everyone at all of our prisons, and we had an outbreak. We had an outbreak that we dealt with and everything. But at the end of the day, really and truly, we did exactly this. We ran to the fire. I've already positioned the National Guard, the DHHR, to be able to be ready with the resources if there is a problem. But really and truly, at the end of the day, how many deaths did we have at those prisons? Zero. And so there's always concern. There's more than always concern. There was a report that came out the other day that said there had not been an instructor. I don't know if it was K through 12 or higher ed, but supposedly there hasn't been an instructor in the world yet that has contracted or gotten this disease from a child. Now, I don't know that there's any truth to that, and I wouldn't run with that at all. But what I'm saying to you is just this. We continue to solicit all the information that we possibly can solicit. And at the end of the day, we're absolutely, with our K through 12 schools, we're going to make it safe for our kids, but we're going to make it safe for our teachers and our service personnel. And if we can't do that, then we're going to back up. The same thing we're going to do with our colleges and our universities.
All right, thank you, Kenny. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. This is Emily Allen from West Virginia Public Broadcasting. 2 questions. First, if a county health department notices a church isn't enforcing your executive order on masks for indoor spaces, what can that health department do? Can they close the church? Can they make the church pay a fee? And then secondly, the city of Morgantown last night passed an emergency ordinance that would let them fine landlords who evict tenants, like the landlord would pay a fee for evicting tenants. Governor, is your office looking at the issue of West Virginians being evicted from their homes who, without a home, can't really adhere to your safer at home guidelines?
Okay, and I think it was Emily, but again, I'm trying to understand exactly what your question is, but I do not think, in fact, I don't have any powers, as far as regulation over the churches and everything to be able to fine people or whatever. From my standpoint, I don't have any powers to do such a thing. From the standpoint of the cities being able to mandate something over the businesses, I guess they have those rights to be able to do just exactly that. But and the last thing, I didn't get the last part of your question.
The last part of my question was just, whether the state would look at addressing evictions. But with the first question, I really wanted to know if county health departments can do anything to enforce your order for masks.
I don't think so. And the reason I don't think so is I think from the county health departments that they have the licensing from the standpoint of alcohol and food. And I do not think that I don't think that the county health departments have the ability to levy potential fines or whatever it may be there.
All right, thank you, Emily. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. Emily and I are actually having the same thoughts today. So I was also wanting to ask you about renters. There was a study that came out yesterday that found that 34% of West Virginians are behind on rent. And so in July, if we lose some of these protections and extra funding, I was just wondering if there's anything you think the state can do to help these people who may be evicted because they're already behind.
Okay, let me, gosh, it looks like, that our experts aren't getting a whole lot of answers here today, but let me tell you what's coming, okay? Now, West Virginia, have I not told you repeatedly that there would be a fourth stimulus package come? I told you that 2 months ago. Now, lo and behold, it's all across the news, all over the place. 4 stimulus packages on the way. Now, West Virginia, I'm going to tell you exactly what's going to happen. I think in the stimulus package. Now, I don't control, how the Congress votes and whatever they come up with. I don't control, that in any way. Now, as far as people's rent and everything and all that kind of stuff, I think that there's court actions that govern all of that situation there. But from the standpoint of the fourth stimulus package, here's what I would look for. Now, don't hold me to this specifically, because all I can tell you is what I think. I have told you I thought that there would be a stimulus package come. It's coming. I've told you I thought that we would be able to revenue replace. We would absolutely be able to revenue replace. I'm going to tell you that when this package rolls out, that it's going to have a relaxing of the rules in regard to the dollars that have already come to the states, and it's going to enable to be able to do what I told you we'd be able to do. In addition to that, I really believe what's going to happen is this. I believe you're going to see the extension of unemployment benefits. I believe you're going to see a rejuvenation of the PPP. And what I mean by that is you may very well be able to, with certain businesses may very well qualify for additional PPE beyond the PPE that they've already received. So from the standpoint of where we are, I really believe you're going to see an extended effort to help our people and encourage our people to be able to get back to work. So with all that, I think you'll see a movement in a direction that could very well be beneficial, significantly beneficial to the lower income families as well.
All right, thank you, Taylor. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. I'll try to get your expert panel involved on this one. Yesterday, Mineral County received word that 2 students had tested positive for COVID-19. And last evening, Superintendent of Schools Troy Ravenscroft announced that all off-season conditioning, gyms, and weight rooms would be closed until August 7th. Is that an overreaction? Is that the proper reaction? And is there any advice that you would give in that situation to the medical panel? Thank you.
Okay, Dr. Amjad or Secretary Crouch, and I want to say one thing about Secretary Crouch. The other day he was on the call with the universities, and he had a different pair of glasses, I think, on, and everybody was walking around saying, "Dag, Bill looks a lot younger." So, Bill, as I'm aging in this process, you're getting younger, so that's good.
Then I need to wear the other glasses more often, Governor. Thank you.
Okay.
Anya, would you like to answer the question? Yeah.
Paul, I don't think that's overreacting. I think that's the right step to take for right now until you get more contact tracing done. So I would say that's the right step for right now until you can do some proper contact tracing and get a handle on anyone else that could possibly have COVID-19. So I would err on the side of caution until you can get a better testing strategy down.
All right, thank you, Paul. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. Ben Salengo just put out a statement a little bit ago calling for an investigation into last summer's tax break for Pleasant's Power Station and the circumstances involving that in light of yesterday's indictments of Ohio House Speaker Larry Householder and associates. Do you have any comments on that? Is that something that you think needs to be done or looked into in light of those circumstances? Thank you.
Well, Stephen, good gracious, we want these briefings to not drift into a political thing, but we take questions and we take questions from everybody, so I've got to address it in the words that I would address it. First of all, anybody and everybody that knows Ben Salengo knows that he's a Nancy Pelosi liberal trial lawyer. That's all there is to it. And from the standpoint of where I stand in front of you every day, you know everything and anything about me. From the standpoint of trying to help preserve all the jobs that are associated with the Pleasance Power Plant and everything, I mean, for crying out loud, I thought it was a terrific decision. Also, from a standpoint of hinting towards that I would take a campaign donation and everything, and do it inappropriately is so ridiculous, it's off the chart. There's no chance in all the world that I would do such a thing. First of all, you got to remember, just go outside and look. I drive to work in my vehicle. I put my gas in my vehicle. I self-fund an incredible amount of my campaign. And if anybody doesn't think that we fully vet with all the lawyers every single donation that comes in, you're just absolutely, whistling through the whatever. But I am just telling you, just as point blank as I can be, you have got a desperate candidate that is so far behind in the polls, we're about ready to lap him. And with all that being said, you've got desperate political tactics and everything from liberal people that love to cast stones, and we don't have time for it. This briefing is not for politics. This briefing is to tend to this terrible killer that's eating us alive, and it's consuming us from the standpoint of our dollars, our health, our mental and spiritual and physical capabilities. And absolutely, we want to pull West Virginia through this in a good way, and we need to stay away from the politics stuff.
All right, Governor, I'll turn it back to you.
Well, it sounds like I've said enough. I do want to comment on the Mon County bars. We are meeting with people and listening and monitoring and doing everything we can do, and we'll be making a decision as far as an extension tomorrow. But nevertheless, we want to continue to try to do anything and everything we can to be able to live with this virus and still have as much normalcy as we possibly can to West Virginians and West Virginia. And again, West Virginia, don't let anybody tell you, no matter what they say, no matter where they say it, don't let anybody tell you that you haven't been the miracle. You are the superstars. Keep on being that.